Hello there, how are you doing? I hope this meets you well. I hope you've been finding helpful content here. Today, I want to talk to you about why you should have periodic medical examinations. Periodic medical examinations, saying that even if you're not ill, you do not have any symptoms, why you should have a check on your health status. I come across people who tell me that I've not been to the hospital in 20 years, and that's great, really. But even if you have no symptoms, sometimes it's good to get yourself checked because there are things that if you discover them early, you can help to nip in the bud, okay? Many of us take our cars for servicing, and that will be even whether or not your car is giving you a problem, but because it's due for an engine check. All right, so how much more our bodies? Now, let me say that one of the leading causes of death worldwide really have to do with things like cardiovascular diseases. Those are diseases of the heart and blood vessels, which could include things like stroke, heart attacks, and more, and also cancers. Now, the thing about these diseases is you can actually find their risk factors early and prevent the possibility of progressing into a full blown disease. So, let's talk about some of the risk factors for cardiovascular diseases, heart attacks, and strokes, for example. Some of them include things like diabetes, hypertension, your high cholesterols, obesity. I mean, just to mention a few, and I'm mentioning a few things that you can actually modify because there are things that there's nothing you can do about them. You might be at risk as a result of your family history, the race you belong to. However, you can do a lot to modify by nipping some of these risk factors in the bud. So it's important that you know your numbers, know your glucose numbers, what is your fasting blood sugar. You should know it, and sometimes we like to know your blood sugar 2 hours after meal. Your doctor may want to have you have your glycated hemoglobin, where it tests your sugar control over 3 months. You should know your blood pressure numbers. People often say, well, doctor, I'm not feeling anything, I feel just fine. The challenge with that is that these diseases are often silent killers, and they will be causing damage to your organs when even if you are not aware of it. Okay, so it's important to know your numbers, and one of the things that knowing your numbers does, it helps you to be more proactive about your health, about making positive lifestyle changes, and if possible, being on medications, because the aim is to prevent bigger problems, right? You want to prevent bigger problems like heart attacks, you want to prevent strokes, you want to prevent going into kidney failure. Right now, when you think about these diseases that I've mentioned, you would see that they are a bigger problem to deal with, which you could have helped to nip in the bud by paying attention to your numbers, your blood pressure numbers, blood sugar numbers, your cholesterol numbers, and your weight. Also, secondly, think about cancer. Some of us might have had somebody who has died of a cancer or who have suffered cancer recently, and it can be devastating. But one of the things again is that it is possible for you to screen and pick early signs of cancer so that you can deal with it there and nip it in the bud. For example, cancer of the cervix or cervical cancer, we encourage women from the age of 21 to get a pap smear. Get a pap smear done and do this at least every 3 years. Should possibly also check your human papilloma virus. Check if you are infected with human papilloma virus. Cancer of the colon. This is quite common now, okay? And the thing about cancer is you want to find it before it spreads because it becomes a much bigger problem when it has. So, how do we screen for this? We request that people from the age of 45 starts to have what you call colonoscopies. Colonoscopies are it's you a camera is put through your anus to look at your large intestines. You can find non-cancerous growths that could later become cancerous, or even if you find a cancerous growth at the early stage, that can be dealt with on time. Sometimes we could also check stool in blood, what we call fecal occult blood. You could decide to do that every year if you like, but at least a colonoscopy every 5 years is quite important. And also, breast cancers are quite common, so we encourage women from the age of 40 to get a mammogram done. Get a mammogram done. It is a it is a form of X-ray that helps can pick early signs of breast cancer, probably every 2 years. It's good for women to be able to do their own breast examinations so that you know your normal breast architecture, and when there is something off, you can talk to your doctor. Okay, so if it is true that a stitch in time saves nine, it's even more true when it comes to your health. When you find problems early, you can deal with them. So why not work with your doctors so that they can arrange for you to have a periodic medical examination to find problems on time. We talk of things like, even in your eyes, we talk of things like glaucoma, right, which can lead to gradual vision loss. And the thing is, you may have no symptoms, but with regular eye checks, possibly on an annual basis, you can get to know if you are at risk. And if you have something like hypertension and diabetes, your risk of eye disease is much more increased. Okay, so I hope you find this helpful, and I hope you take a positive step towards evaluating your own health and taking control of it. Please like, share with somebody who needs this, and please leave a comment. Have a good day.